This is Dentistry Disrupted with Dr. Craig D. Clayton. I'm a wellness and biomimetic dentist, passionate changemaker, social media thought leader, and educator on disrupting the way we approach oral healthcare. Come along with me as we journey towards a healthier and more empowered you. Welcome to today's episode of Dentistry Disrupted. I am super excited about today's episode because I have the great pleasure of being with Dr. Shereen Lim today, albeit virtually. She's in Australia. So thanks for being on the podcast.
No, thanks for having me.
Dr. Lim has advanced training in dental sleep medicine and a decade of experience helping children and adults optimize airway health. She was Australia's first dentist to obtain a postgraduate diploma in dental sleep medicine and is a leading voice on early intervention for sleep and breathing issues worldwide. Dr. Lim is an internationally recognized speaker in the field of dental sleep medicine and airway health, and she's also the author of Breathe, Sleep, Thrive, a groundbreaking book that connects airway health to childhood development, behavior, and long-term wellness. Dr. Lim is passionate about prevention, and she's here to share what every family needs to know about airway health. So welcome to the podcast. So great to have you.
No, thanks so much. So great to be here. I love all the work that you're doing on social media and promoting, holistic dentistry. And I'm really excited that you're involved in airway dentistry now as well.
Thank you. Well, it's been a lot of fun. It's really meaningful to hear from followers and then observing patients the changes in their health. I'm still in that honeymoon period, right? Early in my journey of every time I see these results, it's like, oh, this is so cool. And maybe that never goes away, but it's just honestly such an honor to talk with you because you are such an expert in the field. Can you take us back to the moment where this journey into airway medicine really began for you, not just as a clinician, but with your own family? We'd love to hear your story.
Yeah, my story really began with my husband snoring. It was really driving me quite crazy. So I got out of bed one night, super frustrated. I looked up mandibular advancement devices. I was aware that they could help reduce snoring. And I decided I'm going to learn more of these so I can help other spouses in the same boat. There's got to be a lot like us. And I enrolled in a graduate diploma program in dental sleep medicine. And I became involved in this area as well. So I was able to collaborate with sleep physicians to offer them oral appliances. But then I started to question how come we are intervening with a Band-Aid solution that's really addressing the poor jaw development. How come we don't grow the jaws properly in the first place? And so that's how I got interested in early intervention, because during that course I came across Dr. Christian Guilleminault's work outlining the benefits of palate expansion in children. And I was wondering, how come orthodontists, they never want to treat early? They always want to wait till age 12 before they will do orthodontic treatment. Why don't we grow the jaws whilst children are young? That's what we're taught can happen in dental school, but in reality it doesn't happen. So having young children myself, I decided that I was going to learn how to do early orthodontics because I wanted to be able to do that for them as well. And so that's how I became interested in early orthodontic treatment. I actually met Christian Guilleminault in 2014, and I told him his work had actually inspired me to learn more about palate expansion. And he said, if you're doing palate expansion, you're too late. So I didn't know what that meant at the time, but obviously form follows function. And the poor jaw development is really a reflection of oral dysfunction in the earliest years of life when the jaws are growing the most rapidly. So he was the one that really helped highlight that tongue tie could be a root cause, and also the value of myofunctional therapy. And so that's how I became involved in infant tongue tie release and the myofunctional therapy addressing the root causes as well.
And learning from Dr. Guilleminault he's such a giant. He was the one that coined obstructive sleep apnea, right?
Yeah, absolutely. And he first discovered obstructive sleep apnea in children. 2017, I actually shadowed him for half a day, and that was an amazing experience as well.
Wow.
Yeah, so it was very cool.
Incredible.
In the same week, he actually was looking for me, wanted me to come in and just opened a bottle of wine. Dr. Stanley Liu, he helped facilitate that, and we were just sharing a bottle of wine in the middle of the day. So that's a real amazing memory that I'm super grateful to have had.
Yeah, that's amazing because he passed not too long after, just within, I think, 2019, was
It
it?
may have
I
been
think.
later than that, but yeah,
Okay.
I can't
Yeah, it
recall.
was, yeah, it was not that far after. So
Yeah.
what an opportunity. So you started with your husband. You were tired of listening to the snoring, wanted to help other spouses, and then looked at your children and thought, okay, why let's avoid this problem. Let's start early. What was that journey like specifically with your children, and what did you experience as far as changes, the reduction in symptoms? What were you seeing beforehand? And then as you learned, what did that journey look like as you helped them, and then applied that to the to your patients?
Yeah. Well, my eldest daughter, she's now 18, so I probably missed the boat a little bit with her. I did expand her. She didn't need braces. She had a pretty bad tongue thrust, and she actually had a tongue tie, which I wasn't really able to definitively diagnose early enough. It was like, does she have it? Does she not? So I think her result may not have been great as my younger daughter, but with my youngest daughter, I actually started her at age 6. So at the time, the traditional age for palate expansion is 7 to 8 years. But I decided I was going to go a little bit younger. So she was my first 6-year-old. She'd had her adenoids and tonsils removed, and she was
Okay.
still grinding and bedwetting. And, I just thought about it like all these other children at 7 to 8, they're having improvement of symptoms. So why does it matter what age they are? She didn't have any adult teeth. But yeah, I decided I was going to try her because these symptoms were still persistent after adenotonsillectomy. And yeah, as soon as I did it, those symptoms stopped. And it was she didn't have a particularly narrow vault. So we did that, and she had beautiful spaces between her baby teeth. Her adult teeth have come through beautifully. And facially, I think that she has had a better result. So I started to question, why don't we go younger and younger? And some of my US colleagues, we had the Endeavour group during COVID. Lauren Ballinger, Kevin Boyd, they're very much like, why do you have to wait? Even if a child needs to if they have vision problems, even if they need to get a new pair of glasses every year, if you don't offer that just because they're going to have to change each time, what experience are they missing out on? And yeah, that made so much sense to me, because if a child is not breathing and sleeping well, what are they missing out on? How are they not able to thrive? So I actually started seeing children younger and younger, just getting a little bit lower, and offering it to quite a few 3.5-year-olds as well. And the facial results that are possible, as well as that shift in their health and how they're able to thrive, is really very impactful. So I don't think that we need to wait. And now my preferred age is 5.5 to 6. I prefer to get in well before the adult teeth come through. It just makes all the spaces for everything to come through really well, and it becomes much more simplified. I also do think that when we can create that space, there's less work to break habits of oral dysfunction and just get things working better as well.
That's wonderful. That's beautiful. Did your daughter improve for a time after the tonsils and adenoids were taken out and then relapse again, or did it just not change anything at all?
I think the biggest improvement post-surgery was her not coming into the room in the middle of the night. And that's something that a lot of kids do, and parents don't really recognize that could be a symptom of disturbed breathing. So once she had that, she was able to sleep on her own. But yes, there was the persistent grinding, and I could see her teeth really deteriorating, and that bedwetting. By about age 6, it becomes a little bit awkward for them going to the shops and having to buy the pull-ups. And so these are the things that shifted. She didn't really have any behavioral symptoms or anything in a big way. But for a parent that hears that grinding or sees that destruction of the teeth, it is concerning. So I was happy to take care of that and know that she was able to function better.
That's so great. Yeah, it is alarming to see. I remember when our older son, we started noticing him wearing down his teeth, and I felt powerless because I didn't know why. As a dentist, I learned to, grinding was just,
Mhm.
as you see worn teeth, they're grinding, right? They may be just something else. They may be doing something else like biting on their nails or chewing ice or something, but if they don't have any habits like that, then they're just grinding, make them a night guard. And then that's all you can do. And that's the response I received too, as I was alarmed seeing him wear down his teeth and hearing him grind at night. And I didn't think he had any issues with sleep because he hated breathing through his mouth. He would get really upset if he was sick and couldn't breathe through his nose. And I called a pediatric colleague that was not airway centric, and I didn't even know anything beyond like, dental sleep medicine is appliance therapy, and we use it for adults, and that's about all I knew. And I was really interested in getting into that field and making appliances. And he said, "Oh no, grinding's normal in kids. He'll grow out of it. If he doesn't grow out of it, we can make him a bite guard when he's 8 or 9 years old and he has his permanent teeth if he's wearing those down." Just thought that can't be right.
Mm-hmm.
That can't be right.
Mm-hmm.
And then eventually connected with other colleagues in the area that had learned from Dr. Zaghi, who learned from Dr. Guillemino. And then things started clicking, like, oh, and then saw more and more and more red flags. Like, okay, there's something here. And how often, what percentage of patients would you say that you see that have signs of airway issues or sleep disordered breathing? If you just had to throw like a percentage number out there, what do you think it would be? Like before you really were steeped in this and this became your specialty, when you started noticing like things started clicking, you're like, oh, okay, I know how to evaluate it. What did you find?
Oh, it was so prevalent because I didn't used to see children before either. I was feeling very awkward treating children. It was not my comfort zone at all. So I was mainly seeing adults. But yeah, I think it's very common. You would see it in more than 50% of patients that there is some sort of risk factor there.
Yeah, it's alarming how prevalent it is.
Yeah.
Once I started, kind of similar to you, once I knew the symptoms or signs, then I started evaluating patients. I just thought, wow, the vast majority. So let's talk about the heart of your book, Breathe, Sleep, Thrive. What inspired you to write it? Because that's a big undertaking. I mean, it's one to do a postgraduate program and all the learning that you've done and implementation of systems and all the trial and error that goes into that of getting everything just right. Then on top of that, to write a book, especially, research-backed, evidence-based, and one that just greatly communicates to the common person, the non-medical, non-dental person, patient so well what's going on. What was the inspiration for that?
Yeah, my inspiration really began with wanting to treat younger, because when we see the adults that have obstructive sleep apnea, many of them have quite a despairing quality of life in terms of energy, mood, and their health. And so why couldn't we help grow those jaws earlier? So once I got some skills to be able to do early intervention, I needed to be able to communicate this with children, with parents and families. And often in regular active maintenance, just their general dental appointment, to be able to share all this information is not that easy. And to go from saying, accepting the current orthodontic advice that we can watch and wait, or maybe I've taken out premolar teeth by the request of the orthodontist for a different child, how this time we should do something different for this other child. To communicate that's not a quick thing. So that's why the book came about.
It's not.
To be able to give them some information to take home with them and to help them understand why it is we need to be paying more attention to these jaw structures. And so that was what the book was designed for. It actually took me 6 years. It was a difficult process because...
I'm sure. Yeah.
As a dentist, there's a lot of backlash in terms of people that are trying to push this type of approach. And I was pretty used to defending myself with, here's an evidence, here's a paper, this is why I'm thinking that. And I worked with a couple of coaches, and it was very much textbook. They thought it was too doctorish. And it took me a long time to work out how to not be doctors. So there was a little bit of self-doubt and all that as well. But that 6 years was really helpful as well, because there was so much more new research that I could use to really back my position. And in the end, I think it came out more for the layperson to be able to understand or resonate with. And in doing so, that has actually made it helpful for colleagues to be able to use for their patients as well. So nowadays, I don't have to spend a lot of time convincing people that this is the way to go. But because people just come, they want this expertise. But now I can use this book for others who are in the same boat, who are starting out educating their patients. They can use the book as a promotion as well.
That's great. And this is something we need more of in our world, because there's a lot of great resources, but it's really hard for us doctors to distill things down and to, change the language to in a way that is very easy for anyone to understand. There's a saying in social media content creation world that we should write in a way that a third grade child could understand, so that you really you have a really broad audience that even if, English second language or wherever they are in their journey, or language skill, they can understand. And so you really did a fine job, and I commend you for taking the time to get coaches and to rewrite to be able to distill that down, because there's so much good information out there. There's so many wonderful books. But that's some feedback I've heard from patients. So I'll read it and like, oh, this is great. And then I hear feedback from patients like, yeah, it seemed good, but I couldn't, it was a little high level. So thank you for creating that resource for people. That's wonderful.
Yeah, no, that's super. And, I love what you do on social media. It's so much character and everything. It's very cute. But yeah, I actually engaged a coach as well it was a confidence on camera type of coach.
Okay.
Because it was about just communicating on camera. And I thought that's what I needed during COVID, to be able to communicate on camera. But it actually became about how to communicate your message, to make things short and sharp and cut to the guts of it, right? And really about making sure that your passion comes across, rather than having to artificially do it. Just be yourself. And so that was super helpful to get me over the line with the book.
Well, you're such an engaging person, and so that is wonderful to get that across in your writing. So
yeah.
And this just shows the level that you care, to really how this really demonstrates the passion you have. Like, you want people to understand, no matter their education background or where they are in life. So I love that. And of course, your book does such a fine job at connecting, so many of these puzzle pieces. So the poor sleep and the mouth breathing to things like bedwetting, as you've mentioned, and ADHD, even, or ADHD-like symptoms, even mental health. Why do these connections still get missed?
Yeah, because, current healthcare really is focused on symptoms, addressing symptoms, whether it be high blood pressure or heart disease, diabetes, bedwetting, ADHD type symptoms. And really, everyone's treating things in silos. We have so many specialties and people are dealing with each symptom on its own. However, really what we need to be focusing on is the root causes, and really understanding that sleep is important, as well as diet and physical activity. And when it comes to sleep, we also need to pay attention to how well we're breathing during sleep. So we're not paying enough attention to it. And I think that that's what healthcare is missing, just really understanding that airway health is really the cornerstone of thriving health and vitality. And if we can understand that and what we need to look out for in terms of symptoms within children and adults, or jaw structure and oral dysfunction, if we can understand those as red flags, we'll be able to treat a lot more sort of upstream rather than waiting for those problems to occur.
I hope that sooner than later we start to see this shift, because it is something that desperately needs to happen. How long have you been in the sleep medicine space?
I started with the oral appliance therapy in around 2011, I believe. And then my first talk on early intervention was 2014. And
Amazing.
so it's been a long time. And even then, the very first talk, there was actually, it was a UWA, our university alumni talk. And the orthodontist really pushed for me not to be a speaker. They were trying to tell the organizers, don't have her, you need to replace her. And when they didn't back down, they actually made her say a scope of practice, something. Do not recognize that this is not in your scope of practice. So don't take it too serious. So there was a lot of pushback, but the thing is, things have changed so much now.
You were an early disruptor.
Yeah, it was not fun being quite on your own, but it's just what I was seeing every day, just looking at it. This is preventable. We need to let more people know about it. And so I have done my best at doing that on a professional level, really sharing the research and then connecting the dots for parents as well. And I do believe there's more and more interest. And how is it going to get forward? Definitely a lot of it is by parents, really getting this information out to them, because a lot of them are getting their symptoms missed and dismissed. And if we can help them identify that there could be an underlying cause that could be treated and what are the different ways, a lot of parents can connect with this and they really want to get this care. And to the degree right now, I've had to close my books to not accept new patients because it's just very overwhelming being so far booked out in advance. And our front office is really getting so many emails and messages. I'm from this part of the world. Who can I go to? So I do think that getting to the parents is really important. And at the same time, people like Dr. Steve Carstenston, who is an ADA consultant for breathing-related sleep disorders, really, he has been instrumental in getting that ADA policy statement, 2017, where dentists have a role in screening for these and helping to create the optimal physiological airway. So that really, those type of initiatives, they help encourage more people to learn about this and what they can do for their patients. So it's a combination of factors that is really going to help, but definitely from the parents. I think parents are the best advocates for their children, and connecting them with this information encourages them to go out and speak to their providers about it.
Yes. And when you say ADA, American Dental Association?
Yes. Yeah.
And you know what's interesting? I have to disclose, this is disclosing my age in the career. I started a little bit later, but I was in dental school in 2017. I won't say when I started, but I was in dental school in 2017. And that was something that was never brought up, period. Like, we talked about sleep apnea and oral appliances, like, but briefly, it wasn't, even if we covered it in a little more detail, we were not taught to look for these signs and symptoms. And we had, in our program, we had an oral medicine specialty. It's a newer specialty here in the United States. There's an actual oral medicine, like residency, where they do rotations in the hospital. But we had some really forward-thinking dentists that were wellness-focused. But we, in our comprehensive new patient exams, or comprehensive exams in general, with the extraoral palpating lymph nodes and checking the skin, signs of head and neck cancer, and then looking in the mouth and doing these full evaluations, we never looked at airway. And so, honestly, I didn't even know that initiative of the ADA was even happened. Like, that's news to me today. And I should have been hearing about that in dental school where I'm getting trained. It's wild to hear.
Yeah. And, I like yourself, having children that have been affected by it. In my practice, I see a lot of various healthcare professionals that have had the experience of going through a tongue-tie release with their child or breathing problems. And so that's another fantastic thing that's happening as well. When they can see the impacts that it makes for their own children, that's when a lot of people become passionate and want to learn more as well.
Yeah, nothing like having to go through it with your kids to really open the eyes and like, oh, this is actually a thing. It's not the first time I've heard that. Well, I commend you for sticking it out and being resilient. And I can certainly empathize in a way, just dealing with the hate that we get on social media, being
Yeah.
disruptive. And I did have some classmates reach out too and say some not great things because it was disruptive to, and mine's been more focused on, traditional dentistry, like don't get crowns until you look at your other options. Like don't just default to that, because that's what happens in the US. It's just like everything's a crown. And cavities, just the teaching like, oh, you're just unlucky, or you're eating too much sugar and not brushing, whatever. And it's been interesting as well to see how the patients that have the problem, like Airway, are receptive and say thank you. And then the providers and the hygienists in the comments are the ones that are cursing my name, saying you're crazy, you're money hungry, you're just trying to drive in patients, or you're just spreading fear. But then they start to come around. It's interesting to then respond to these people and say, hey, well, go look at these resources, go check this out before you speak an opinion about something that you probably haven't read anything about.
Yeah, I mean, what you've done is clearly resonating, though. Matt, our coach, has really said, I've got to watch what you're doing because of the following that you've amassed. And I think it's fantastic that you're getting into the airway space now, because you are having so many people that are listening to you, and there's so many people that need to be connected with this information.
Well, I'm grateful to have your mentorship, and again, to be able to get you on this podcast, to have professionals in the space, because I'm newer in my journey. There's so much to learn, but that is something that is the mission of our platform, is to just spread awareness and then get people wherever they are in the world to their local expert that can then help them. Do you have a recent standout? I mean, you probably have so many cases day in and day out, but could you share one case maybe that came to you recently where you saw a pretty dramatic change? The classic, you had a child that a parent brought to you that was told by other providers so they don't have a problem, or this is the only solution. And then you took them through. Can you share a case with our listeners just to really demonstrate?
Normally I wouldn't be able to come up with stuff on the spot, but I have had a fairly recent case which actually made me feel very inspired. I had a mum post their journey on social media, so that's why it's kind of fresh. But basically, when her child was an infant, she had been to several lactation consultants with feeding issues, and everybody had dismissed her. And finally, someone said to her, go visit me to address it. And through us, we were able to address tongue tie, and that changed their feeding journey. And a lot of parents, when they're dismissed so many times and they're struggling with issues, it affects them mentally and emotionally. That really helped change their trajectory. And at the time I had said, oh, look, your child has a high palate. This is the links. These are the potential symptoms that could play out down the track, which would warrant early intervention. And she wrote that she had registered it, but not thought about it. But then at age 2.5, her child had chronic respiratory issues. So the child couldn't breathe and sleep well, and everybody was telling her it's okay, your child's going to grow out of it. But she knew there was a problem, because out of every month, her child was sick for 2 weeks. And she had to sleep with her child, and she couldn't breathe to the point that she was often vomiting when she was coughing, and life was pretty miserable until she went to a chiropractor who actually said, oh, this child has a high and narrow palate. You might want to see Shereen. And so she came back again, and we started some palate expansion around age 3.5. And so we completed the first round. And then the mum had another baby. So I missed kind of following that up. And now a few years later, she shared this story, how that had changed her life because she had stopped studying, stopped work. And now her kid was thriving again and was not sick anymore. But you just often don't know what difference it's made in a child's life. And not only that, to affect the whole parent and family dynamic, because when a mum is not under stress, they're able to sleep and function better and give more to their child as well. And not only that, when I commented, she said that she missed the visits to the practice because it felt like home to them.
I love that.
And then she has become an advocate. So she's posting and saying to people, tongue ties, palate expansion, oral dysfunction, they're things that you need to look out for. So to me, that is the perfect standout type of patient journey to be involved in, where we've helped people that have been missed and dismissed so many times and helped them find an answer that has really changed their life. And it really illustrates that when we do these tongue-tie releases in infancy, it's just not fix and that's it. We should be monitoring children as they grow older and helping them through the various other stages.
Yes. Yeah. Wow, that's a powerful story. I'm glad you had that follow-up, or just that case was brought to your attention again when the mother started posting about it and sharing the story. What a win.
Yeah, it's a great win. It makes you feel good, and really those type of stories really inspire me to make sure that more people don't miss these clues early.
Yes. Yeah, that is key. And on that topic, what is something that you hope every parent walks away with after reading your book, Breathe, Sleep, Thrive?
Yeah, I would like them to be able to recognize when things are off track and to trust their intuition when things are wrong, that, hey, there is something that could be addressed. And even if we miss certain boats, for instance, if we had breastfeeding problems with an undiagnosed tongue tie, it's quite common for parents to come in for consult and they'll be in tears because they knew there was something wrong, but no one identified it. But to just feel reassured that, okay, we've missed one boat, but there's actually many other ways that we can actually approach the problem and help get children on track. So just for them to feel really empowered to know what it is they need to be looking out for, what are the opportunities, if we've missed it, what else can we do? That's the main thing that I'd like them to know about.
That is a hopeful message.
Mm-hmm.
Very hopeful. So if you're a parent listening and you recognize signs beforehand, and now this podcast is confirming your suspicions that something's going on, I hope you take comfort in what Dr. Lim has just shared, that there's hope and there's lots of different avenues to be able to treat these issues and the root cause, no matter where your child is, whether they're infant struggling to feed, or 3 years old, or 6 years old, or 12 years old, that there are ways to be able to treat them. So, Dr. Lim, if a parent listening to this is concerned about a child or concerned about themselves, I know you're in Australia, but you're so well connected with professionals really all over the world. What are some tips you can give our listeners to help them find help them find a provider that's in their area or not terribly far from them, to be able to help them start their journey?
I usually, as a first point, offer a couple of directories. So one of them is for the American Academy of Physiologic Medicine and Dentistry. I'm not sure if you're a member of that one. AAPMD?
I am. I have been meaning to join that. So
yeah, I think it's
that is
fantastic one too.
It's one of the many memberships I've been wanting to join. I'm just trying to pace myself in my learning.
Yeah, I mean, that's a fantastic one that promotes integrative care. And so there's memberships, professionals from various professional backgrounds, whether it's bodywork or dentist or myofunctional therapist. So I encourage people to see if there's someone in their area, even if it's not the person, if they're looking for a dentist, but there is a physiotherapist or someone else, to just reach out to that person, because that person is likely to have their own network. And the other directory that I really like is the Breathe Institute, because many of the people on the Breathe Institute have actually done courses with the Breathe Institute, and I believe that their courses are fantastic options for healthcare professionals. They're always advancing information and quite generous in their knowledge and their research. And so people that have done one of their training courses tend to be quite committed to learning more on what is new in this area.
Okay. So what are your parting words? We've talked about so many good things, and you've shared so much knowledge and inspiration. Just as reflecting on our conversation, is there anything else specific that you want to say to our listeners?
Yeah, I think the take-home message really is that nasal breathing is the foundation for good sleep, breathing, and health. And when it comes to nasal breathing, we really need to take a more integrative approach. It's not really about just going to an ENT and getting your adenoids and tonsils removed. It's really, we need to consider the jaw structures, because that palate or the upper jaw plays a really important structural contribution to our nasal breathing. And we need to pay attention to the habits and the muscle functions as well. So we need really good tongue to palate suction to seal off the mouth breathing route, and making sure children can close their mouth and they get good lip seal. So it's a combination of approaches that really involves multiple people. So it doesn't all start and end with ENT surgery. There's an important role for it, but if we want to promote nasal breathing, these are the factors that we need to look at.
That's truly a collaborative approach.
Mm-hmm.
Yeah, no single person has the cure for it. So thanks. I think that's really important for people to understand, is this multifaceted approach. There's not a singular easy way to fix it. It does require a team, but then it benefits the person the rest of their life. Mm-hmm. So if we're not breathing well, we can't, and not sleeping well, we certainly can't thrive.
Yes.
Well, where can our listeners get your book and follow your work?
Yeah, to buy the book, you can get it from Amazon, or it's available through multiple online booksellers. So Amazon is usually the first port of call, and then you can Google it and hopefully find it. In terms of learning more, for professionals, I recommend my Facebook group, Airway Health for Kids, which is a number 4. That's where I share a lot of research. And for parents, to find out more, the place that I'm most active is really Facebook. I'm active in sharing whatever case that has really made me feel really quite proud and inspired, or new research or new information. That's where I'm most active.
That is so generous, that for parents to be able to follow your work and see your cases and kind of day in, day out, see what you're doing. That's really neat. We'll include links in the show notes to be able to find Dr. Lim's book. And we can include some links too for the Facebook groups for parents and providers. It's just been wonderful to have you on this podcast. I learn from you every time we chat, and we need to chat more frequently for sure, because you are just an inspiring person. And I've been smiling this whole time because it's been fun. It's a pleasure to learn from you.
I really appreciate being connected with you, with Eliza and you. I can see how much passion you are, and it's just really great to have that energy going between us. So thank you.
Yeah. Oh, absolutely. It's been great. Well, thank you again for being on our podcast. And thank you, listeners, for tuning in to another episode of Dentistry Disrupted. And we'll talk with you soon.